Hello and welcome to another video about healthy diet and lifestyle with registered dietitian Danielle Carr. Hi Danny, so good to see you.
Thank you. Great to see you and be here as well.
Yeah, thank you so much for joining us. I really look forward to talking to you. You have so many good things to tell us, so much great advice to give us. A little bit about Dani. She's been in the wellness industry for 20 years and has been a dietitian for 14 years and is an expert on healthy eating and fitness. And she has a YouTube channel called The Fit Girl and Fat Boy, where she teaches you how to cook and eat healthy. I highly recommend it because it's very entertaining and informative. She does it with her husband, and it's a really great dynamic, a really great chemistry going on there. So, and a little bit about me. I am Dr. Eva Mackey. I'm your host, and I'm a family practice doctor, and I have a clinic in Rockwall. It's called Rockwalls Gem MD. It's a family medicine clinic, but it's different from most family medicine clinics because it is direct primary care. That means that I have eliminated the bureaucracy of medicine in order to get you better quality care and control the price. So insurance is not required in this model, and it's concierge quality care and complete price transparency. So definitely look me up. That's Dr. Eva Mackey, Rockwall's Gem MD in Rockwall, Texas. Dani and I today are going to be talking about healthy eating to lower blood pressure. And I'm going to start by giving you a little information about blood pressure. What is blood pressure exactly? Well, blood pressure is the pressure exerted by your blood on arterial walls. And why is high blood pressure harmful? Well, think of the blood being delivered to your organs similar to a gardener watering his flowers. So if the gardener waters with a watering can, it's nice and gentle, and so it gets the flowers the water they need without injuring them. Now, if the gardener were to water his flowers with a pressure hose, he would destroy his flowers in the process of trying to water them. So when you have high blood pressure, it's like you are spraying your essential organs, your heart, your brain, your kidneys, with a pressure hose. And that does a lot of damage to your organs over the long term. If you continue to have high blood pressure, you will develop things like kidney failure, congestive heart failure. You may have a stroke. It damages so many things, your eyes, it damages a lot of things. So what causes high blood pressure? It's usually hard to pinpoint one thing that causes high blood pressure. There's usually several things that are involved. And genetics is one of them, but there's a lot of things that we can control, like being overweight is a huge contributing factor. Things like drinking alcohol or smoking cigarettes or vaping, just nicotine in general. Of course, your diet is really important. So that is what Danielle is here to talk to us about. And I can prescribe medicines for high blood pressure, but honestly, nothing thrills me more than when people can get it under control with their diet and with exercise. So Dani, tell us, what are the main nutritional concerns that you see with high blood pressure?
Yeah, well, I'm so thankful that you brought me on because your blood pressure is such a big deal. I think it's 1 in 3 Americans, right, can have hypertension. And I think so many people, we might think it's in our genetics, or so many people will say, well, I don't really add a lot of sodium or when I eat okay, or I eat healthy. But a lot of times we don't really know what we're doing and what we need to change, which can be really simple changes. Food and nutrients are a big part of it, but sodium is the most researched when it comes to hypertension. And it's the most impactful. And so, as you know, it's regulated at the kidneys. And if we're healthy, we consume more, our kidneys are going to help secrete more, and vice versa. But 30 to 40% of Americans are salt sensitive, meaning that their kidneys are less efficient at excreting the sodium. And again, most of the time, we don't know that we're eating more sodium. I have so many clients that will say, well, I don't add salt to my food, so there's no way I get more sodium. But it's incredible how much sodium is in prepackaged foods, restaurant foods, and things that I know will go into. But you can have a high sodium diet and not even know it.
So how much sodium should we have?
So we should have, there's so many different, well, a few different recommendations. One, the main one being less than 2,300 milligrams a day. And so what does that mean to somebody? An easy way to measure it is 1 teaspoon of sodium. Just one little tiny teaspoon of salt is 2,300 milligrams right there. So you can imagine how much we might add, and the food that we have just on a general basis. Most Americans, this is a pretty interesting fact, that most Americans have an average of a minimum of 3,500 milligrams a day. Most, though, actually have 6,000 to 7,000 milligrams a day.
Wow.
So that's about triple of what we've been doing. And over, isn't that amazing?
Yeah, way too much sodium in our diet. That's the truth.
Yeah. And interestingly, over 75% of that comes from prepackaged foods and restaurant foods. So quick, easy stuff that we're usually used to getting on the go.
Yeah. So how do we know how much sodium we're getting?
Really great question. Best way you can do this is read food labels. So if you just look at the food labels and just start, you'll be so surprised again how much sodium foods have in it. And I'll give you the best things that you can do when you're looking at food labels of what to get, especially canned foods. But you want to see no salt added or unsalted on the label, sodium free, low sodium or very low sodium. Okay. So any high sodium foods, a general recommendation for looking at high sodium foods is anything that's 400 milligrams or above. So canned soups are huge. But let me go through those food labels real quick, because unsalted means absolutely no salt added, right? Sodium free means it has less than 5 milligrams in it. Low sodium means it has 140 milligrams or less. And then reduced sodium is a big one to watch out. So if you have a pen and paper and you're watching this online or wherever you're watching this, write that down, those food labels. Reduced sodium does not always mean that it's a lower sodium food.
Right. And unsalted
think of it this way. That just means that it's 25% less. Yeah. Good.
Yeah.
So like, let's say there's chicken noodle soup. An average serving is 890 milligrams of chicken noodle soup. Okay? Well, if you buy the reduced sodium, you're thinking, oh, that's good. Well, it's lower sodium. Well, it's only 25% less than this canned soup that has almost 900 milligrams of sodium. So you're still getting like 600 milligrams of sodium in that canned soup. So you got to really watch those things. It should be less than 400 milligrams. If you go in your pantry now and you look and you're like, oh, I've got all these canned foods or canned beans, and there's none that say, lower sodium or no salt added. Well, you can just rinse those, and that'll take pretty much almost all of the sodium off that's added.
That's a helpful tip. And I think that the labels can be really misleading, because I know unsalted doesn't mean that there's no salt in it. It just means they didn't add any extra salt.
Yes.
Yeah. So just be careful. Just really look at how many milligrams of sodium it has.
Yeah, that's one of the best ways. Usually the salt that you add in let's say you're going to have canned green beans and you're going to get no salt added canned green beans. Well, the salt that you add is going to be about 4 times less than what's added with them individually. So
right.
Add your salt.
Yeah. So, and then also I think be careful of things that say no fat, because they might have no fat, but often just to maintain the flavor, they replace fat with salt and sugar.
Yes, absolutely. Or like any dairies, if you do low fat dairy, they're usually going to add extra sodium for that taste.
Right. I know. Get rid of one thing and you add another.
Yep. Yeah. So, and that's such a confusing part of the science of nutrition. And I know that's why a lot of people are just like, I'm done. But think about what you're focusing on. And if it's the sodium, you'll start to see like, oh, I didn't know that had 800 milligrams of sodium. I should go for a different alternative.
Yeah. So a lot of people, I talk to people about reducing salt in their diet, and a lot of people say that when they do that it doesn't taste as good anymore. Do you have any suggestions about that? Because people have a hard time sticking to a low sodium diet because they don't like the way it tastes.
Yes. And that's usually the part where people will start and then they stop right away because they think, well, food's not tasting good. I'm not going to enjoy it. So why does this matter? Well, you'll notice a difference, absolutely, if you start changing to lower sodium foods. Best part is you can literally change your taste buds. So I promise that you can. I think we just have to work on things gradually. So one of the things you can do is, if things are too bland, just kind of gradually introduce salt, meaning cut back just a little bit on what you're serving at each meal. That'll be a good thing to do. Gradually cutting back on the lower table salt foods and then just adding salt. And eventually you really will start. I mean, it takes about 30 days. And once you start to do that, and then you add back in, let's say we'll stick with the canned green bean example. You're having canned green beans without salt added, but you're adding salt in yourself just a little bit. Meaning the label said no salt added. And then you have that after 30 days, you have canned green beans that have full salt added. You will be like, whoa. So there is not, I have never worked with somebody that doesn't say that that's happened to them. So just kind of gradually cut back, and you'll start to see a difference when you have added things in that are more salt added.
Yeah, I think that our taste buds have been trained to like this incredibly high salt food, and it doesn't have to be that way.
Yeah. You said the best word right there. Our taste buds are trained. We can retrain it, just like we can retrain our brain, our mind.
For sure. What are some foods that are naturally high in sodium?
Another great question. So the foods that are naturally high in sodium are especially going to be, of course, we talked about canned foods, anything like olives, pickles, sauerkraut, smoked meats. Those are extremely high in sodium. Definitely any processed foods, any snack foods, like look at the back of your Doritos, any junk foods. Why do they taste so good? Well, they have a perfect combination of sweet and salty, right? So they add a lot of salt to bring out that sweetness also. Condiments, so ketchup, you'll be amazed at how much sodium ketchup has in it, and mustard. And not that you can't have those things, just watch the serving size. So if you just used to douse your fries, let's say, in ketchup, well, that's one thing you might start to cut back on. Maybe you haven't cut back on the salty fries, but you can cut back on the really salty ketchup and just cut back a little bit. Cheese is really high in salt. Salad dressing. So again, I know I'm just listing, but one of the biggest things is just kind of start looking at the food labels. Restaurant foods are just incredibly high in sodium.
Yeah, that's the truth. I noticed that whenever I go out to eat, restaurant food is really salty, sometimes too salty for me. And we eat out at restaurants all the time. And you know what? That is not likely to change anytime soon. I was wondering what kind of suggestions you have for us when we're dining out. How can we eat out at restaurants and reduce the sodium in our diet?
Yes. Okay. So here's the thing. Well, watch the extras and the add-ons. That's a big part of it. So skipping the extra cheese, or just skipping the cheese in general. Restaurants make their food pretty good enough to where you don't even need the cheese. It's just we're not used to that, and we love cheese. Cheese is good. But if you're watching your sodium intake, that's something you can cut back on. Bacon, of course, loaded with sodium. Anything that has like cream sauces or cream-based gravies. Appetizers are loaded, like what is it? The Awesome Blossom at On the Border? Is that On the Border? Trying to mind blank. Not On the Border. Anybody watching this is like, steakhouse. Anyway, everybody knows the Awesome Blossom. Well, that has like 10,000 milligrams of sodium. If you have a little serving in general, it has about 4,000 milligrams, meaning like a little fourth of it. So really watching that. Some alternate choices are a plain hamburger or non-breaded chicken versus a fried chicken part. Or some people think, well, I'm going to get fish, so that's better. Fried fish is just loaded with sodium. So I'd rather somebody do a plain hamburger or non-breaded chicken. Of course, choosing meat or fish, roasted, poached. Earlier I talked about salad dressings. So with the salad dressing, you could do lemon juice, or you could do vinegar and oil. And that's really good. And add your own salt and pepper. Again, the extras. So if like you're getting a baked potato, we'll skip the cheese maybe, or add a lot less onto it. But it's interesting, the foods that we think are doing really good. So let's say you get some boneless wings at Buffalo Wild Wings. Well, a serving right there is going to be about 4,000 milligrams. And remember, we need, I'll keep going back to this, less than 2,300 milligrams a day. So just
Wow.
in that one little meal, we ate 4,000 milligrams.
Yeah.
And so would I tell somebody not to get wings? No, wings they're a great option for many other things also, but you want to maybe watch your sodium the rest of the day, right? And know that you're enjoying that sodium there. You can ask for less sauce. You could always ask for no sauce.
Sauce on
Um,
the
yeah, sauce on the side, and it's still gonna be good. Another idea, I don't know if you've ever heard of this, but whatever sandwich shop you go to, a 12-inch sandwich is about 4,000 milligrams also. So you think, oh, do I need a 12-inch? Maybe you can get a 6-inch, and you're
Yeah.
still getting about 2,000 milligrams. So still your daily intake, but you've cut it back from what you used to be doing. So all of this is always about these gradual changes that will become lifelong habit. So yeah, just really definitely watch the sides, watch the salad dressings. There are alternatives that you can get, even though restaurant foods are really high in salt.
All right. Well, Dani, you have been so helpful. And I want to know, do you have any additional tips just moving forward?
Sure. I'll just kind of re-emphasize the change gradually. Again, the science of nutrition can be confusing, it can be overwhelming, it can be frustrating because we're told to watch all of these things. If I can give you one tip, maybe start by using no more than a fourth a teaspoon of salt daily. So if one teaspoon of salt is 2,300 milligrams, a fourth a teaspoon is about, I think that's like 590 or 600 milligrams a day. So you can see it's still a good amount, but just kind of watch that. Always choosing fresh fruits and fresh vegetables. Like we'll always say, watch, shop around the perimeter of the grocery store because those fresh fruits and vegetables have absolutely no salt added. And you can add your own salt at home. My second tip would be it's a change. And with any change, these are changes that we're making of 10, 20, 30, 40, 50 years of habits. So forgive yourself if you slip up. Forgive yourself if now you've gone out to eat 3 days in a row or 3 nights in a row and you're like, oh, I forgot. I didn't even look at the menu. Forgive yourself. I always talk about rewarding yourself with non-food treats with accomplishments, but that can be for another topic another day. But know that this is going to be a change. Your taste buds aren't used to it. So forgive yourself for the slip ups and just keep reading those food labels. And then one of the other things, well, I'll give you 4. So the third thing would be to add physical activity. To boost our blood pressuring, the lowering efforts, we've got to increase our physical activity. Remember, our heart is a muscle. And the more we start to train that heart and train that muscle over and over, it's going to be better at pumping the blood through our body. The DASH diet, if anybody wants to look at the DASH diet, that's a great DASH diet. It's a dietary approach to stopping hypertension is what that stands for. And that's a great thing to follow for the whole family. And then the fourth thing would be get support if you need it. If you're having trouble sticking to your diet, talk to your doctor. Hopefully it's Dr. Eva. You can't tell. I just love how much you are so into getting people off medications than just throwing them on a medication. I think that is rare to find. So talk to your doctor about it, talk to your dietitian about it, and then get some helpful tips too with the DASH diet. Those are the 4 things that I would say I'd recommend.
Yeah, that's great. Those are great suggestions. I love all of those. And I just want to thank you again, Dani. You have been so helpful. You've given us so much great information and so much that we need to work on going forward. So it's all about the salt when it comes to high blood pressure. And I think that we have some work to do, I think, to get our blood pressure down. And hopefully, if people start working on this, maybe I can get some people off of blood pressure medicine. Although I will warn you, don't stop your blood pressure medicine without talking to your doctor. But if you follow these tips, it may be a possibility. So I do appreciate your help.
Yes, well, I thank you for having me on. It's all about those little things we can get in our brain and think, all right, I'm just going to work on this one thing. And you'll start to make changes. So I really appreciate you having me.
Yeah. Well, until next time, I'll see you later.
All right. Bye. Thank you.